Imagine, if you will, a system where a physician's success is not measured by how many procedures they perform, or how many referrals that they write, or not even how many medications that they prescribe, but their success is measured by the outcome of the patient's health over time. Hello, my name is Christopher Bergen, and this is my persuasive speech titled Value-Based Care, the Best Path Forward for Patients and Physicians. For those of you that don't know, healthcare organizations can operate under one of two models. The old volume-based, which means that the more patients that is seen, the more money that the organization recoups, versus this new ACO value-based model, where it's more of a patient-centered care. Physicians are incentivized, and the organization is incentivized to drive down costs based on meeting certain criteria, keeping patients out of the hospital, because that's where the majority of healthcare costs funnels through. Because today's healthcare is burdened by a misaligned incentive structure that rewards quantity over quality. And so there's this shift moving into this more of a quality-based. In my thesis statement is the value-based care outperforms volume-based systems across outcomes, efficiency, clinical engagement, and system resilience, and therefore should be embraced as the future of healthcare delivery evolves over time. Now, I have four different main points I want to discuss in this speech. The first is value-based care models reshape a clinician's core purpose. And it takes them, like I said, from performing more services to delivering meaningful care. Professors Michael Porter and Elizabeth Teisberg wrote in an article for the National Library of Medicine, and it says, true value in healthcare is measured improvement in a patient's health outcomes for the cost of achieving that improvement. By implementing the value-based care, it reconnects physicians with their healing mission, it reduces burnout, and it fosters interdisciplinary collaboration. My second point is empirical evidence demonstrates tangible gains for the organizations. In a study conducted by the Frontier Media Journal of Public Health, it says a scoping review of the value-based care implementation shows systematic improvements in patient outcomes, it reduces healthcare costs, and it enhances the quality of care when supported by outcome measurement, digital tools, and performance transparency. Similarly, a comparative study was done by the Journal of Internal Medicine, revealed that organizations transitioning to that value-based care framework achieve better long-term outcomes and cost efficiencies versus the old fee-for-service models. And it's notable to expand on the integrated system like Carelon Health, that over their first year reported 18% lower cost, 42% fewer hospital admissions, and 67% fewer diabetic amputations compared to the old fee-for-service. This real-world results highlighted how the population health management and proactive care can radically outperform the whole volume system. My third point is the shift from volume to value signals a cultural transformation. Like I said earlier, it takes the entire organization to make this happen and to be successful. Qualitative findings from the Accountable Care Organization, the ACO, indicates that reorienting organizations toward the value care that embrace accountability, population health, collaboration, and quality over quantity. This cultural foundation is essential for sustainable impact in healthcare delivery. And finally, the value-based model aligns with the strategic goals of the organization. That has to be priority. The fee-for-service system inadvertently promoted overutilization, so it cut down on needed appointments, and it just bottlenecked the system. And in conclusion, the value-based care model outshines the volume-based predecessor across four domains: patient outcomes, cost-effectiveness, clinician engagement, and system resilience. Physicians and healthcare leaders must champion this shift, not just for physical optimization, but to preserve the integrity and future of the professional and patient-centered medicine. Thank you.